Good morning, my name is Ms. Sherrard, and today we're going to talk about how to don sterile gloves. First things first, you need to remove your jewelry and any watches, as they may contaminate you while trying to don sterile gloves. Next, you want to wash your hands with soap and water and have access to an alcohol-based sanitizer for the actual process. Next step is you need to find your size of gloves. Similar to non-sterile gloves, sterile gloves come in a range of sizes. If you are unsure of which size glove you need, ask one of your instructors and we will be more than happy to help you find the right size glove for you. Now that I have gotten my gloves, I'm going to make sure I have a clean table. I will have wiped the table and it is clean, it is dry. I will get my gloves and I will prepare to don them. My hands are clean, I've washed them, I've used an alcohol-based cleanser, my hands are dry. Please keep in mind that your glove package may look different than mine. Once you get your gloves out of the external plastic wrapper, you will want to align them in the shape of an open book. If your gloves come packaged creased in the middle, unfold them and again open them like a book. Please note, you have a lip on the top, a lip on the bottom, and two lips in the middle. Please do not touch the center stripe as it is sterile. What you'll want to do is gently crease in the opposite direction, the top and the bottom lip, so that they do not fold back in on you while trying to open your package. Next, while grabbing the corners of the inner lip, open the inside of the package, creasing the corners again, so your package does not fold back in on itself. This entire area is now sterile. Please keep in mind this 1-inch sterile border and maintain the sterility of any objects outside the field. For this first example, I will be donning my dominant, my right hand first. Please notice that there is a cuff design on your glove. That is to help you while donning your sterile gloves. With my non-dominant hand, I am going to touch the opening portion of the inside of my dominant glove. This is the inside of the glove, that's the outside. With your bare skin, you only want to touch the inside portion of the glove. You can only touch the outside portion of the glove with another sterile glove. So, lifting the glove carefully, I will make an opening and slide my dominant hand into the glove. Please keep in mind to give yourself ample space so you do not contaminate your glove on the table or your body. Give yourself lots of room and slowly and carefully slide your fingers into the correct holes. Once you're there, gently using your non-dominant hand, pinch on the palm and pull the rest of the glove up your wrist. Now you have a sterile hand. With your sterile gloved hand, lift the cuff of your second glove, keeping in mind that you will only be touching the outside portion of the glove. Create that opening one more time. Watch your sterile thumb. Do not grab here while donning your other hand. If you do, you run the risk of touching it against your hand. So keep this thumb as far away as possible, or tuck it inside if you're unsure. Then gently slide this hand in place like you did with the first glove. Notice how I'm pulling the glove up while still staying inside and staying sterile. Now I have sterile gloves and I'm good to go. To remove your sterile gloves after you've done your procedure, you don't want to get the nastiness that was on there on your bare skin, so you can pinch the inside or pinch right here in the middle, gently pull down, and then do the same. Remember, this is the inside of the glove that you're using to touch the outside, and now you will never have to touch your bare skin to the outside of your glove. You may dispose of your dirty gloves in the appropriate trash receptacle, cleanse your hands, and you're good to go. Now, we're going to do a second example with a different pair of gloves, and this time I will don my left hand first. Notice how I accidentally got 2 fingers into 1 finger hole. That is okay. I will show you in just a second how to fix it. If you are able to, carry on and don your other glove, but be cautious of this loose finger. Now that I have 2 sterile gloves, I can gently and carefully fix the fingers to get them where they should be. Okay, now I'm sterile and I'm good to go. I've done my procedure. I don't want to get any germs from the procedure on my bare skin, so I'm gently going to pull back, remove, using the inside of the glove, pull back, remove, and I've never had to touch the outside of the glove to my skin. Cleanse your hands and dispose of your trash in the appropriate receptacle. Thank you for watching. Good luck.